Awesome. Hello, everyone. This is so fun in the chat, just seeing where everybody is joining us from. I think one of the benefits of a post-COVID world is just how connected we are virtually. So I'm in Edmonton, and so I'm seeing people from the East Coast, from Vancouver. So this is absolutely fabulous. So this webinar is being recorded, and I believe, and Johnny can maybe comment on this at the end, that this recording will be posted to Healthy Planet's YouTube channel. And then just a couple of housekeeping items just to keep us rolling, because A, it's a big topic. B, I could talk about this all day, every day. And I also just want to be able to answer your questions. So feel free to interact in the chat. I'm not going to be manning the chat necessarily, so I can just keep focused on the content and the material. But Johnny will be watching the chat. He'll be flagging any questions. However, if you do have questions, please put them in the Q&A box, because it just keeps track of everything there. So I know what questions I've asked or what questions I've answered. Because sometimes I'll get to your question either in a coming slide, or I know at some point I will be answering your question during the presentation. Usually I front load the presentations where I'm getting more into the background information, and then the back end of the presentation, we're going to be talking about solutions, obviously, when it comes to plant medicine. So that's just logistically where you can put those questions. I will forewarn you, I hope dogs stay quiet in the back. I'm just dog sitting, so I fenced them off, and hopefully we don't have any interruptions, but I might have to mute myself and deal with that. But otherwise, I think they found a good sunspot to sleep in. So as Johnny mentioned, I'm a naturopathic doctor. I'm practicing in Edmonton, Alberta. So my practice is primarily focused in women's health and fertility. And so there's lots of tools that we can use when it comes to women's health and fertility, but this will be obviously geared towards plant medicine in supporting women's health. But again, if you've been on presentations with me before, or my teaching style is I really want people to understand the foundations and the reasoning behind why we're doing certain things. So I think that will prompt, again, some other questions. I do request that your questions are more so catered to the topic at hand. Unfortunately, I can't give medical advice in this scenario. But again, any type of questions surrounding the women's health topic, I'm happy to get to, and again, we can maybe get to that even after kind of the whole content and scope of the presentation today. All right, so obviously we're focusing on women's health, and then our takeaways for today is that I want to review, or for some of you, learning about the menstrual cycle and hormone signaling. Again, so when we talk about these different interventions, where are they actually integrating into the hormonal cycle, how your brain is talking to your ovaries, how these feedback mechanisms are working, or even how other systems are supporting hormones, right? Because when we even think about the function of hormones, those are communicators. So it's not just an isolated system where it's your brain talking to these target tissues, but how are those hormones playing in our body? How are we metabolizing and breaking these down? What are these target tissues responsible for? Cardiovascular health, bone health. Again, it can be quite expansive with this topic. We're going to differentiate between a few of St. Francis's products, including PMS support, menstrual tonic, and regular flow. And I will go through a flow chart, and yes, the pun is intended, in finding slightly like an algorithm of understanding maybe what product might be a good fit for you. And then we're going to talk about hormonal systems with products such as Hepato-DR and Stressed, because again, these are being connected, how our hormones are interacting with these other systems as well. Okay. So buckle in, because we're going to stay on this slide for a little while. And also with this slide, so if I'm still on this slide, just know that I didn't forget to advance it, but we will settle in and talk a little bit more about this communication. And again, as I've mentioned, like why this is important is the level of intervention of botanical medicine will work at these different target tissues, right? So it's not all phytoestrogen or plant estrogen herbs. They might be working on the brain signaling, so the brain talking to your ovaries or your target tissues, or again, how this feedback mechanism is coming back to talk to the brain. So when we look here at our two kind of brain centers that are talking, so we have our pituitary gland and we have our hypothalamus. And these two brain centers are working together as essentially like our hormonal master glands. So the hypothalamus is going to make a hormone called gonadotropin releasing hormone, so GnRH, and that's going to tell the pituitary to make and or release different hormone or different chemical signaling, okay? So FSH and LH. So you can see these names here, these FSH and the LH. So FSH, follicle stimulating hormone, this is what tells our follicles or our eggs to mature into eggs to be fertilized. FSH is also going to stimulate ovarian production of estrogen. And we'll talk about how this hormonal symphony is essentially orchestrated throughout the menstrual cycle or throughout the ovulatory cycle in a coming slide. But essentially you're establishing, okay, follicle stimulating hormone, it's acting on the follicle or the egg. And again, when we're looking at that, talking to the ovaries are going to respond by also producing estrogen. So then we have this luteinizing hormone here, or LH, and this is the hormone that's going to stimulate ovulation, or essentially the release of an egg. And we will maintain something called the corpus luteum, which is essentially a remnant of that follicle or a remnant of that egg, and that's going to make our progesterone. So when we see this target action here, we're looking at the ovary, we're looking at the uterus. And then again, some of our target hormones that we're talking about are our estrogens. And there's actually, three different types. We have E1, E2, E3, and these are going to work on multiple tissues in the body. We also have progesterone, or you can think about it as progestation. So that is ideally the goal is to support a pregnancy. Okay, so progestation, progesterone. Okay. So, as I mentioned, this is super simplified because it doesn't show us what other tissues these hormones are working on, how these hormones might be made in other places in the body as well, how they are broken down, and also how they are eliminated. So even when we're talking about like an interventional model, like these different plant medicines, they may be missing, again, the metabolism piece, they may be missing the different target tissues, but primarily a lot of them are focusing on this communication of the brain to the ovaries and the ovaries back to the brain. All right, so the menstrual cycle. So we're going to be talking about the menstrual cycle in the event of no fertilization, no implantation, no pregnancy. Okay. And when we talk about like what is a regular cycle, typically we're classifying that as like a 28-day cycle. Now there's going to be natural variation, and oftentimes people are like, well, a healthy menstrual cycle is 28. I think only 15% of women have like a true 28-day cycle. And typically for me, I'm doing 28 days plus or minus 1 or 2. When we start seeing like really huge deviations and variations from that, that's when we may be considering like either a functional hormonal issue, or we might be seeing like different pathologies or conditions affecting that as well. So when we look at this chart here, so we see the menstrual phase being divided into two different components. So we have our follicular phase, which is predominant from the period or day 1 up until mid-cycle or ovulation. And then the latter part of the cycle is called the luteal phase. And we'll talk about like why those different names matter and essentially what's happening in that part of the cycle. When we look at these lines, the orange, so let's talk about the teal first. So this teal color here, this is our estrogen. This orange line here, this is our FSH. this, or yeah, the yellow line is the FSH, this orange line is luteinizing hormone, and then this purple is the progesterone. We'll just go back here. Okay. So day 1 is going to be the day of a first full bleed. Okay. So if somebody is spotting, that is considered part of their previous cycle. And this is important to note and to track as well, because spotting can give us some indications that there may be a functional hormone deficiency, or again, a condition associated with that as well. It's also important for tracking and determining that day 1, because if we're testing your hormones, we need to test it on a specific day of the cycle, because we have specific reference ranges based on where you are in your cycle. I've had multiple people see their physicians and like, man, it doesn't matter when you get your blood work done, just go for blood work. And then I get it back, and then I'm asking which day of their cycle they were on, because I can clearly tell either from their estrogen levels or their progesterone that they did not go on day 3. So again, that is important with cycle tracking to understand what day you are for testing, and then also to relay this information to your physician to help kind of decode what is happening within your body. So day 1 is the day of a first full bleed. And then what's going to happen is like shedding of the uterine lining or the endometrium. And from a kind of top-down perspective, the brain is going to talk to the ovaries, and it's going to tell it to do 2 things. So one is to develop a follicle or an egg, right? So that's why we call it our follicular phase. We're developing that follicle. And the second is going to be to make estrogen. So then this blue or teal line here is your estrogen is going to creep up and 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 up. And then that height or that peak of estrogen is what's going to trigger ovulation or release of this luteinizing hormone in this orange here. Now, some things that are interesting is that as estrogen is rising, we have cells on our cervix that are responsive to estrogen levels, and they start producing like mucus, essentially. A lot of people call it discharge. I think that has a negative connotation, and discharge for me is associated with infection or some irregularities or abnormalities in the microbiome, but we will see cervical mucus changes. So like kind of at the height of fertility, right before that ovulatory window or that spike in luteinizing hormone, we would want to see cervical mucus in raw egg white consistency. So after that peak of estrogen, we're going to release or have a spike in that luteinizing hormone. So if people are doing like ovulatory predicting kits or OPKs or LH strips, this is the hormone that they're testing, is this orange line, this luteinizing hormone. And then there we're going to ovulate and we're going to release an egg. So you can think about that egg as being kind of like a sunny side up egg, where the yolk leaves and looks to get fertilized, and the egg white that stays around is what's going to make our progesterone. So that kind of egg white that stays around, that's called our corpus luteum, and that's why this part is called the luteal phase. So the corpus luteum is going to make our progesterone. Progesterone is going to maintain our uterine lining, allow for implantation. It's going to actually change how the immune system functions to allow for implantation. And then what happens is progesterone is going to drop because we didn't have implantation or fertilization. And this abrupt drop in progesterone is what will cause a bleed, right? So this is also what birth control is mimicking. So the absence or withdrawal of that progesterone is what allows for like a withdrawal bleed, like what we would see, while being on the pill. So some misconceptions as well. Somebody's like, well, I'm having a period. Does that that means I'm ovulating? Not necessarily. You can have a period without ovulating. So just timing of that, we can, determine what's happening with your cycle. Okay. So we talked about the follicular phase. We talked about ovulation. We talked about this luteal phase. So sometimes we'll actually see changes in this progesterone causing premenstrual symptoms. Okay, so we might see breast tenderness, we might see mood changes like irritability, weepiness, sleep disruption, bloating or fluid retention. And sometimes it's about, how much progesterone you're producing, if that is in an optimal ratio with your estrogen as well. And again, so having all of these symptoms in our back pocket or tracking these help inform your physician about what is actually happening from a hormonal cycle. So we can think about the uterine lining being like a brick wall, where estrogen is the bricks and progesterone is the mortar that seals everything in. So lots of estrogen, lots of bricks. Sometimes we can see heavier flow. Maybe sometimes we're seeing clots. If we see a lot of spotting, or especially like premenstrually, if there is a lot of spotting in that phase, maybe we don't have sufficient levels of progesterone to maintain, again, that mortar that seals all of those bricks in, or we might get that abrupt drop of progesterone too quickly. So again, all of these things are really important, having awareness. And I always talk to my patients about your menstrual cycle being like your fifth vital sign. So just like I tell people to investigate or know what's happening with their bowel movements, we can also get that same feedback with your menstrual cycle. So rather it being like a daily report card, like what you're getting from your poop information, with your menstrual cycle, that's kind of your monthly report card to understand what's happening, with your cycle as well. Okay, so also want to say that the day 14 for ovulation is a myth. So mathematically, we can equate that mid-cycle of 28 days would be, day 14. I also have a lot of people coming into my office saying, well, I ovulated because my app told me I did. And your app is essentially a mathematical equation based on the data that you're inputting. So it is guessing of when your ovulatory window would be based on the information you're putting in the app. So I have a 28-day cycle, I have a 32-day cycle. It's taking the average and trying to determine when that ovulatory window is. Now, there's other means to track this as well, where we get what I call like biometric markers that also feed into those apps and can give us more information, such as BBT or basal body temperature. And the reason that works is, see this rise in progesterone here. So mid-cycle, we see this rise in progesterone. Progesterone is what we call a thermogenic hormone. It's actually going to increase the amount of, it's going to increase your body temperature, and it also increases the amount of calories that you burn based on the increase in your body temperature. So if we see a shift in your basal or your base body temperature, we can presume that you ovulated because there's the presence of progesterone. Okay. So we see the presence of progesterone, our body temperature increases. So if you're waiting, like if in a fertility perspective, if you're waiting to see that temperature shift before you start actively trying, you actually miss the ovulatory window. So it's good just for feedback to understand when your ovulation is. So say you see a temperature shift on day 15, you probably ovulated on day 14 as well. So just some considerations there. So you can do the old school, you can use a thermometer. Some people, I think Apple, like their new Apple watches are actually measuring temperature now, and it's integrating into the various health apps. Oura rings are another option. So it's measuring your temperature as well. So again, it's another means of using, technology for that body awareness. Okay, I'm just gonna have a quick peek at the chat. Okay, so eczema, I'll come back to that. Mako, I'll come back to that. Okay, weight gain, bladder stuff. Okay. It's gonna be for menopause when I'm trying to balance your hormones. Okay. We'll get to talking about menopause a little bit later on, but I might talk about just perimenopause while I'm seeing this. Very consistent regular period. Okay, perfect. So I'll come back to that. Okay. All right. So, and yeah, you can see that in the chat. Those are just in the question box. So those are questions that I'll have to come back to, more so when we get to talking about products. Okay. So when we see, and honestly, like I hate the term perimenopause. I hate it because peri just means around. So around menopause, and we see these different constellations of symptoms. Now, perimenopause can be 6 months before total cessation of your period, which is like the diagnostic criteria for menopause would be absence of a cycle for 12 months, with like normal cycles prior to that. But people might have perimenopausal symptoms for 10 years. I see a lot of 40-year-olds in my practice, and they're starting to notice some changes in their cycle. So what happens is we see something called a loop cycle or luteal out of phase. So because our egg numbers and the efficacy or the functioning of our ovaries is dwindling, what happens is ovulation becomes less effective, or maybe we might not mature a follicle to be able to ovulate. So what happens is, again, we don't ovulate, or sometimes we call it like a bummer ovulation. Things didn't really go the way we wanted to. We maybe don't produce any progesterone because we didn't ovulate, or maybe we don't produce as much progesterone. So that feedback comes back to the brain, and your brain will be like starting to yell louder. Okay. So it'll be like, hey, you didn't ovulate. You didn't do what you were supposed to do. So I'm going to yell louder for you to actually do what you're supposed to do. Your FSH goes up, your estrogen tries to match it as well, depending on where you are in that perimenopausal stage. So then potentially we'll see estrogen climb. We see a thicker uterine lining that cycle. Maybe we might see a short cycle. We might see an even longer cycle, depending where you're at. And then the next cycle, it might be a long cycle after that. So essentially it's your body trying to calibrate based on this feedback from your system, and your brain trying to adjust that. That's also why hormonal testing in perimenopause doesn't give us a ton of information, because you could test somebody on their day 3 one cycle, and it can look like they're in full-blown menopause because their estrogen is super low and their FSH is really high. And in the following cycle, they could have normal FSH and their estrogen could be high. So again, like hormonal testing in that phase doesn't really change our treatment plan. Okay. So when we get to the topic of women's health, there are several products that we're going to talk about. We might breeze through a couple of them a little bit more quickly, just based on some of the questions that I'm seeing and where people want me to focus. So we'll talk about PMS support, menstrual tonic, regular flow, UTI clear, menopause support, Calogel, and breast oil. Okay. So here's another buckle in slide with our women's health guide or our flow chart. Okay. So with this, and I know that there will be some outstanding symptoms that are not addressed with this, again, because a lot of these herbs are working in that brain talking to ovaries, ovaries talking to brain. So one of the first questions that I want to establish to determine what product might be beneficial for somebody is their cycle regular? And when I say regular, is it like 28 days plus or minus 2? Okay. If we're seeing a super short cycle, or we're maybe seeing like 24 days, but then they're spotting for more than that, like they're spotting for a week, we would consider that, an irregular cycle. This could be a super long cycle, right? That we're seeing like 34 or longer than that. So essentially our first question is their cycle regular? And I don't mean absence of symptoms. Again, I'm strictly talking about the length of the cycle. So let's follow that pathway down. Like, is it a regular cycle? No. Okay. So then we're getting into the question, like, are they perimenopausal? So symptomatically, what we might be seeing is like hot flashes and night sweats. We might see some of the symptomatology of those loop cycles. So we can see, a really long cycle. We can see a short cycle. We can see a really heavy clotty cycle that's abnormal for that person. And then a super light cycle. Is there brain fog, memory loss? Are we seeing changes in their lipid profile? weight gain, sleep disruption, fun things about having a uterus. Okay. So perimenopausal, if they are, then we might consider something like menopause support. And we'll talk about some of the options or additional benefits of taking menopause support, because we're alleviating a lot of those symptoms. But again, it's also working on that brain to ovary, ovary to brain communication. If somebody is not menopausal, then we may just consider like straight chaste tree, like as a single tincture. Okay. So let's go back to the top. And then, so yes, their cycle is regular. Is it heavy? Okay. If it is heavy, then essentially one of our first priorities is going to be management of the blood flow. We're trying to reduce the blood flow. And that's when we would consider an astringent product and like uterine tonic, like our regular flow. Now, if somebody's like, no, it's not a heavy period, it's not a heavy period, then we're kind of going like, is it painful? Okay. If the answer is no, and we're seeing like short cycles, PMS, fertility issues, that would kind of shunt us back to chaste tree. And we'll talk about why chaste tree is so, beneficial. Okay. So somebody's periods aren't super heavy, but they are painful. Okay. So this is where we can use some combo products or some stacking, is that cramp bark can be used during the period. So this could be something like either in lieu of like an ibuprofen, naproxen, Advil, Midol, whatever somebody is using for pain management, or it can even be used synergistically. So I don't have a problem if somebody's like, yeah, I'll start on my cramp bark, or also this presentation or kind of our product line was built out before we encapsulated our ginger, but ginger is also a lovely one for painful periods and really, really good research on it. And I'll talk about some of the key differences here. But cramp bark people can utilize. And if they have like breakthrough pain, then you could use like, their kind of pain management of choice, whether that be a Midol, an ibuprofen, and naproxen. And especially if the painful periods are more like cramping or contraction like in nature, I find cramp bark to be like the absolute ticket. If we're feeling like it's more of like an inflammatory type pain, it's more like dull, diffuse, achy, it extends into the back. Ginger is also fabulous. It is a pelvic antioxidant, so it's an anti-inflammatory. It's a pelvic circulatory stimulant as well. So sometimes, again, and this is where if somebody's like, well, my periods are heavy and they're painful, sometimes we don't want to go down this avenue because we can make the bleeding worse. So that's why I'm just distinguishing or discriminating between these two kind of flows or channels of this algorithm. Okay, so we talked about cramp bark. We talked about gingers being like acute management for pain. Now, is there something that we can do throughout the cycle to try and limit that? Okay, so if somebody has like light, scanty flow, like they're like, yeah, it's not that heavy. Maybe it's more brown or like old blood, or my acupuncturist tells me I have like blood stasis. That's when we would go to something like menstrual tonic, again, because we're kind of tonifying those hormones throughout the cycle. And then we can use pain management like the cramp bark or the ginger. Now, if somebody's not of the light scanty, but it's painful, then we might look to something like black cohosh, because it's going to help regulate that feedback, again, brain to ovary, ovary to brain, specifically more so on like FSH and luteinizing hormones. So it's actually a really good estrogen modulator. It's not a true phytoestrogen or plant estrogen. And then so you'd be using the black cohosh, it'd be working on the hormonal piece. It's also a really fabulous antispasmodic. So again, it can reduce the inflammatory capacity that's happening premenstrually. So you can look to eliminate that heading into the cycle, and then use the other stuff as pain management during the cycle. Okay, so that's kind of how that flow chart works. And then I am just going to have a peek here. Again, I think there might be some that I might get to more specific products. Okay. Oh, there's lots. Okay. Okay, I'm gonna bump into the first product and I'll come back to that. But again, there's some really great, lovely questions. And again, some of them are a bit beyond the scope of this, but I'll try my best to get to those as well. Okay. So PMS support, this is like our Vitex Complete. So this is indicated if experiencing PMS, symptoms such as muscle aches, insomnia, tension, irritability, cramping, breast tenderness, mood swings. And this is a formula hinged on Chastry or hormone normalizer. So again, this is more of a synergistic product. We're working on different pathways, but I really want to highlight like Chastry or Vitex as a herb in and of itself. This is one of our most effective and also one of most versatile herbs, but I think a herb that requires like some tweaking, sometimes some skill and some knowledge with utilizing this herb. Again, the dosing can really vary, and I don't want people to be of the mind frame like if some is good, more is better, because that's definitely not the case with Chastry, because high doses of Chastry can actually suppress pituitary function, which sometimes we're actually looking to do clinically. But again, that's not super common and not for all cases of when we would, indicate using Chastry or for some cycle regularity. So my suggestion is if you were looking to try Chastry on your own and not under guidance or supervision or recommendations of dosing, start at the lower end of dosing. Like a little bit can go a really long way. I have a friend, and we call it the Leah factor, where like she takes 5 drops of Chastry, not 5 mils, 5 drops. And if she goes over that, she'll notice breast tenderness and mood changes. So capsules don't work with her, but tinctures are so lovely for that flexibility with dosing. But for her, 5 drops is all she needs. Again, that's the Leah factor. She's an anomaly, but I would say stick to the lower end of the reference range unless we need to, increase that. Okay. So where we see really great benefits and why from that flow chart, we started to support or look at those menstrual cycle irregularities or the length, is it helps to regulate the length of the cycle. So this can be from what we call secondary amenorrhea. So somebody had a period, but then, like they went through menarche, so they had their first period, but they might be skipping periods or they may have lost a period. Sometimes, and again, in the literature, it's debated for using Chastry after coming off of oral contraceptive pills or the birth control pill. I use it in some situations. Again, usually I'm doing a bit more of a deep dive when it comes to exploring the reasons why their cycle hasn't come back. We can see it in what we call oligomenorrhea, so really long menstrual cycles, or polymenorrhea, where we're seeing really short or frequent cycles, where there's cycles where we're not ovulating. So some people where we're not seeing changes in their luteinizing hormone. So in a lot of fertility patients that I have, they'll be using those OPKs or ovulation predictor kits, or those LH urine strips. And they're like, it's like faintly positive near the beginning. I don't really get they're squinting at their test. I'm like, no. It should be a distinct like negative and positive. If we're seeing like subtleties in that, sometimes that means our luteinizing hormone is too high when it's not supposed to be. And that most commonly we're seeing in a condition called PCOS. And I saw some questions in the chat about PCOS, so polycystic ovarian syndrome. Again, a name that I really hate because it's this huge overarching nomenclature that is lumping all of these women together when they shouldn't necessarily be lumped together with the same, condition, because we have more metabolic PCOS, where we're seeing a lot of pre-diabetes, diabetes, insulin resistance. And then we have some people at, the opposite end of the spectrum who might be like low estrogen, but they look like from a lab perspective or from their cycles that they have PCOS, but they actually don't. So again, this might be an indication for those people who maybe not be ovulating, whether that be from PCOS or maybe that's for a different reason. It does act
Dr.
on.
B,
Yep.
So one of the questions was, are there any herbs that can help with PCOS?
Yeah. So again, it's kind of dependent on, again, the type of PCOS. Like I would say majority of PCOS is insulin resistance. So while Vitex might help you ovulate, we're missing like that metabolic or that insulin resistance piece. And again, pros and cons of that. If somebody is looking to get pregnant, so ovulate to get pregnant, yes, they might conceive, but based on that insulin resistance, they may have a higher rate of miscarriage, or they may have some negative outcomes associated with the pregnancy. If we're looking to ovulate, even to just get a period, because I know a lot of physicians are like, you haven't had your period in 6 months, here's a progesterone prescription, which I actually do recommend in my practice for some individuals. Again, the Vitex might be indicated, but really, truly, the insulin resistance piece would be of utmost importance in PCOS. And I know there's some other questions about symptoms of PCOS, or at least there are questions: what do these symptoms mean? Which I'll talk about PCOS kind of at the end. We may see some improvements to, so we talked about we can increase luteinizing hormones. So again, helping to regulate ovulation. We can see this when we have insufficient progesterone production, or sometimes we call it a luteal phase defect. So remember, we have our follicular phase and our luteal phase. So sometimes with the projected ovulation, you might only have 7 days after that. So we might see, a 4-day cycle, and you still ovulated on day 14. If you're looking to get pregnant, that's not enough to allow for implantation, because this inflammatory cascade, or we call prostaglandins, will already be released, and that immune change will happen. So we won't get implantation before that uterine lining is shed. We can also see this with high levels of prolactin. So prolactin is a hormone also released from those 2 master glands, or communication, those master glands. That's why a lot of breastfeeding, women don't get a cycle or don't ovulate, because their prolactin is really high. So their prolactin is actually suppressing ovulation. Prolactin can also be high from stress. Prolactin can also be high from alcohol consumption. So all of these things can decrease your likelihood of ovulating. This can also play into PMS, because again, we talked about that either abrupt drop in progesterone that is causing these PMS symptoms. It might be the disparity or the difference between your estrogen and progesterone that's causing these different PMS symptoms. And we can also see this in menopausal support. Again, I think there's some herbs that function a little bit better for menopause, but there are chase trees and a lot of formulas for menopause, not only from some cycle dysregulation, but again, that's inevitable. Like those loop cycles will happen. You're not going to ovulate for the rest of your life because you don't have an unlimited supply of eggs. But some of the benefits of Vitex or chase tree in menopause is that we can bind to what we call beta estrogen receptors. Now, estrogen can bind to alpha receptors. So those are things where we see our hormonal type symptoms, or those hormonal type tissues, like your breasts or ovaries or the uterus, all have those alpha receptors. So think potent action. But then we have, again, our supporting cast that has these beta estrogen receptors, so less potent, and that's our brain. Yes, you have estrogen receptors in our brain, and that's why some people have mood dysregulation, with PMS or a drop in their estrogen, why some people get mood changes, depression, brain fog, with perimenopause or menopause. People I feel like I'm going crazy. Like, you're not crazy. It's just your hormones. Okay. We have those beta estrogen receptors on our heart. So we see changes in our cardiovascular system. So we see higher incidence of high blood pressure. We see people having no issues with their cholesterol, and then post-menopause they're like, you have high cholesterol. Well, it's because we have beta estrogen receptors on our liver that are protecting that. We have it on our bones that are protecting that. So sometimes we can see, you know, additional benefits with chaste tree in menopause. Okay. Was there anything super pertinent with chaste tree that you found in the chat, or can I keep bumping along?
I didn't see any questions about chaste tree specifically, so.
Okay, perfect.
The Q&A box is bumping. There's a lot of
I know, I'm just seeing stuff coming in, but don't worry. I think there'll be some overlap in questions too, because I think like you can't see each other's questions, so I might be able to, you know, do extra. Okay, so for the menstrual tonics, remember on that flow chart, we're talking about, you know, scanty periods or light periods that are also painful. This used to be called Dong Quai combo. And what I really like about this one is that it's really supporting like uterine circulation. So like if an acupuncturist would ever be like, you have painful periods because you have blood stasis, like this should be your jam. Like this is where we would see some benefits. So blue cohosh, black cohosh, wild yam, ginger, all really lovely pelvic circulatory stimulants and anti-inflammatories. But Dong Quai is kind of like that secret sauce that supports blood flow where it's connected with estrogen. So again, those really light menstrual cycles that are painful, I see this being really, really quite beneficial. Okay, regular flow. This is a fabulous product. Okay, so the indication for this is heavy menstruation. So this used to be called Capsella combo, and Capsella is shepherd's purse. Okay, so shepherd's purse is an astringent or tannin-rich herb that looks to reduce like blood flow. Okay, so kind of the opposite of Dong Quai. And Dong Quai, we're promoting blood flow. In regular flow, we're preventing the heaviness of a menstrual cycle. So looking to essentially relieve menorrhagia or heavy menstruation. And it does this. And if you've been on education with me, I talk about herbs that have their indications or their actions. So we see astringent, right? But tissue specificity. So shepherd's purse has astringent qualities specific to the uterus. And again, this formulation will have other astringent or kind of like not necessarily clot promoting, but essentially astringent or reducing the amount of blood flow. So like wild geranium and yarrow, there is a bit of chaste tree in here as well. So it's reducing the amount of bleeding. Now, Capsella I've seen be as if not more effective than tranexamic acid. So a lot of people, they go see their gynecologist or their GP. They'll try tranexamic acid first. Tranexamic acid tends to be a bit more clotting. So even though you're not bleeding super heavy, you'll get be passing these huge massive clots. Some people might have other symptoms associated with the tranexamic acid. But because we're having that astringent quality and it's also a uterine tonic, we're preventing like that huge lining buildup, and this can be really, really beneficial. So you can use it throughout the cycle, but primarily I'm getting people taking it like up to their bleeding or during bleeding to be, quite effective there. Okay. UTI clear. Now I know this seems like, well, you're talking about hormones. Now we're talking about UTIs. The reason that it's included like in our female line or in our women's line is that based on anatomy, women are more prone to having urinary tract infections based on the location of the urethra to the vagina, the short nature of the urethra. So we can have ascending or bacteria going up into the urinary tract, into the bladder, into the kidneys. So this has, and also with perimenopause, menopause, postmenopause, we have what we call atrophy or kind of thinning of the urethra, the vagina, the vulva as a whole. We see that tissue thinning, and therefore you're more susceptible to urinary tract infections. So this product is used as a urinary antiseptic, meaning it's antibacterial on location. So it's not like stimulating your immune system like a lot of our other immune products. It's working like directly on that bacteria. So that's why we say it's to relieve uncomplicated urinary tract infections, because if somebody has recurrent issues, it might be a different type of bacteria. It might not actually be bacteria at all. It might be like IC or interstitial cystitis that feels like a urinary tract infection, but there's no bacteria actually present. So this is indicated uncomplicated urinary tract infections. So we see the benefit is that it's antiseptic or antibacterial on location of that bacteria. But anytime we're trying to reduce colonization or issues with that bacteria in the urinary tract, we want to pee. Okay. And that's why everybody like increases their water intake, they're down in cranberry juice, all of these things to try and flush that bacteria out, right? Because if we're urinating, we have, momentum to try and pee that bacteria out. So it does include diuretics to help promote that. But it also contains herbs like marshmallow that's going to coat and soothe and protect that irritated tissue as well. So we're kind of getting that trifecta of antiseptic or antibacterial or antimicrobial, diuretic, and then also relieving that inflamed or irritated urinary tract. Okay, menopause support. So this used to be called a Vitex combo. So I mentioned why, Vitex can be useful in menopause. But this is where we're seeing some other benefits of these herbs in promoting or reducing some of those other symptoms. So I did talk about black cohosh earlier, where it's not a true phytoestrogen, but it's more of an estrogen normalizer because it's working on, those brain centers like FSH and LH within our system to, again, regulate that phytoestrogen. That's where we see a lot of the symptoms in perimenopause and menopause, especially postmenopause, because we see it being like jumping off a cliff, right? So we have a lot of estrogen and then we have none. And that shift in the estrogen is typically what causes a lot of what we call those vasomotor symptoms, so hot flashes, night sweats. So this, or any type of phyto or plant estrogenic support, is rather than jumping off a cliff, we're going to help you just like walk down the hill instead. So just the gradual decline. And then we have other herbs in here for, again, reducing hot flashes and night sweats. So our cooling sage is fabulous for hot flashes, and adaptogenic rhodiola. Now, rhodiola, secret sauce when it comes to perimenopause or menopause. And so I don't have a slide just talking about rhodiola on its own, but this is just a bridge between this conversation. So rhodiola is beneficial for a few different reasons in perimenopause and menopause. Number one, it is what we call a SERM, or a selective estrogen receptor modulator. So we can see some estrogen balancing with rhodiola. The second being, it is a cooling herb by nature. So it can help some of those vasomotor symptoms, hot flashes, night sweats. It also is a cognitive support. So again, the brain fog, mood disruption happening with perimenopause, it can also be beneficial. It is cardioprotective or heart protective. Again, the absence of estrogen, we see some cardiovascular implications. It is also an adaptogen and adrenal tonic, which leads me to this slide. But do you see it's just like tick, 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 tick. Like, to me, if menopause was a herb, she'd be rhodiola. So I really, really, really love using rhodiola in perimenopause and menopause. Okay. So the conversation of adrenals and adaptogens in perimenopause, or just hormones in general. So first off, when the ovarian reserve dwindles, so we don't have any more eggs, we're not ovulating, we're not having as susceptible cells in the ovaries that are producing estrogen, where does that estrogen production go? our adrenal glands pick up the slack, and our adrenal glands are supporting our estrogen production, not to the degree that our ovaries were, but again, our adrenals are supporting our estrogen production. So that's why a lot of perimenopause and menopausal symptoms are worse with stress. Oh, you got like bothered by your boss at work and boom, hot flash. Yeah, that's your adrenals and your nervous system regulation. You had a death in the family, and then now you're getting the hot sweats or like night sweats, or we're seeing more brain fog. Yeah, because your adrenals are taxed with cortisol regulation as opposed to your estrogen production. So that's why, again, a lot of those symptoms are worse with stress. But again, also an indication of we really need to support our adrenal glands when it comes to perimenopause and menopause. Okay, soapbox over. Now, when it comes to pre-menopause, so kind of in your fertile or reproductive years, adaptogens can still be useful, right? And again, we see stress causing dysregulation with ovulation. We see stress causing issues with progesterone production, or even susceptibility of the uterine lining for implantation if we're talking about fertility. So there's a lot of indications, again, why stress management would be important. But so stress is our cortisol regulating, our adrenal tonic, or our adaptogenic blend that also supports the nervous system, which I think is also another key piece when we talk about stress management. Okay. I think I want to skip over the next couple topical products, and I just want to make a quick note. Okay, so we have Calogel, which is a vaginal moisturizer, not a lubricant, but a moisturizer. Okay. Breast oil, I more so see this with like fibrocystic breasts. It talks about mastitis. You can use it for mastitis, just not on that same nursing side. But usually I'm recommending the breast oil, or like an accelerated kind of castor oil for fibrocystic breasts if we're going to use that. But again, a ton of other applications of castor oil that you can use the breast oil for. Okay, so hepato-GR, because we talked a lot about like making hormones, but we didn't talk anything about breaking hormones and metabolizing them. So when I talk to my patients about the function of the liver is like our huge industrial complex, right? And we have different factories that are going to be responsible for different things. So we have factories that are responsible for breaking down toxins, pharmaceuticals. We have factories that are responsible for cholesterol, for blood cell breakdown, and we have specific factories for our hormones. Okay, so when we talk about the liver being like a key support for hormonal health, this is important for how we metabolize or how we break down our hormones and eliminate them, right? So this formula does feature milk thistle with this active constituent silymarin. So this helps bolster like overall liver function. And silymarin can be quite useful for, again, all of those different factories, not necessarily super factory specific, but again, overall supporting those different factories that are metabolizing our estrogen. Supports liver and gallbladder function, for bile production and flow. Bile is also very supportive for eliminating our hormones, right? So once we use our hormones, we want to break them down and eliminate them. So bile production, super useful for that. And hepato-GR is supporting our bile production there. So there are, again, other specific factory products that work on those factories, but from a herbal perspective, overall liver support, we could consider hepato-GR or even just a straight milk thistle. Okay, so I know this is opening a huge window for questions. So I'm just going to have a quick peek to see if there's ones that I can kind of lump together. And then also I might at some point turn off the recording, and then I'm happy to stay on and answer questions. Just because this is being, pushed to a different platform, we want it to be just concise with the information. But again, I think the question period we can draw out. Okay. So, okay, just let me have a peek here.
Good luck, by the way.
Pardon me?
Good luck.
Oh, thanks. Okay, so there is a couple here. They're the same questions. Okay, so relationship between hormonal imbalance and severe eczema. And then eczema with stopping the use of an IUD for many years caused skin issues. Okay, so when it comes to eczema, when it comes to the immune system, when it comes to histamine, these are all interconnected. Okay. So what we can see is that estrogen, and sometimes estrogen unopposed by progesterone, can be an issue with severe eczema. So eczema, if we look at it as like an autoimmune or an overactive immune system, sometimes progesterone and ovulating regularly can be supportive for our immune system. Progesterone actually helps to lower the immune response. And that's why, like in pregnancy, when we have a plethora of progesterone, why some autoimmune conditions get better. Okay. Now, I know that can get a little bit confusing with like IUDs, because IUDs are like, okay, an IUD is progesterone. Well, it's not progesterone, it's a progestin. So it's a synthetic form of progesterone. But again, the question of what's stopping the use of an IUD for many years caused skin issues, right? So your body is not ovulating, you're not producing as much progesterone. You take out the IUD, you don't have that progestin available. So you may see a ramp up of the immune system. So that could be a consideration. I also see like premenstrual hives. I've seen premenstrual, like we call it like a period flu, where people will get like joint aches and fever, and like it'll feel like a literal flu. And again, typically it's just the suppression or the drop in progesterone that causes, that issue for them. And also sometimes where post-menopause, we might see that as well. Okay, so I answered that live.
A quick one relating, can you
Yep.
take rhodiola if you're taking progesterone supplement?
Progesterone, yes. I know on the like on our health claims or the NPNs and like cautions and contraindications for rhodiola, it will say no HRT, so hormone replacement therapy, and no oral contraceptive or birth control pill. The reason being is that it's a SERM, so a selective estrogen receptor modulator, so it's going to work on estrogen. But if you're on a progesterone, there's no interaction there, but just be mindful that, again, it might not be the best fit for you, but you could technically with a progestin. Yeah, that would be okay. Okay, so there's a question. I'll come back to the maca because that's a bigger conversation. So hormones or lack thereof for weight gain. Okay, so when we see hormonal changes causing weight gain, I have seen this with, say, like IUDs being inserted, and I know a lot of GPs will say, there's no side effects of weight gain with IUDs. There 100% is. I've seen it clinically, and sometimes we're seeing it being related to fluid retention. Sometimes it actually is changing metabolism as well, so insulin sensitivity and insulin resistance. We also do know that post-menopause, with the absence of estrogen, we're more prone to difficulties losing weight. So oftentimes at our clinic, and our priority is really focusing on metabolic health. So for me, like when I look at, like I said, testing your hormones in perimenopause probably doesn't give us a ton of information. Testing your lipid profile and your insulin sensitivity, absolutely, we can test and we can have an effect on. And so we can modulate, again, nutrition, and we can talk about supplements, specific training to help reduce or prevent that weight gain associated with that as well. And again, if somebody has a hormonal condition like PCOS, again, that insulin resistance piece will make it harder to lose weight. So I do recommend that people get they're insulin tested. So not only just what we call an HbA1c and a fasting glucose, that just tells us your HbA1c tells us what is your average blood sugar over time. So throughout, how sugared is your red blood cell getting over its lifespan. Your fasting glucose, which just tells us what your system is doing without food and how your sugar is being like leveled or changed or altered. But that doesn't tell us about insulin resistance. So a fasting insulin will, and that would be an indication of how we can, work on and prevent any weight gain associated with that. Okay. So bladder problems. Okay. So bladder problems, couple of things when I see bladder issues, urinary issues in like women in general. If somebody has never seen a pelvic floor physiotherapist, that is my first referral. Even if you've had kids, if you have not had kids, even if you were pregnant and kids were born by cesarean and not vaginal birth, you still should see a pelvic floor physiotherapist at least once in your life, get an assessment. Sometimes it has to do with just structurally that there are issues. Sometimes it's voiding patterns. They're so supportive, and they are the absolute experts when it comes to constipation, bladder problems, vaginal dryness, pelvic pain. They are so fabulous. I'd say they're one of my top referrals. So that would be a consideration. Sometimes with bladder problems, we do see that with vaginal dryness or atrophy. So a vaginal moisturizer, sometimes with hyaluronic acid, can be helpful. Sometimes if it's like urination or urination changes are happening, we do want to understand like your blood sugar and your insulin to make sure that it's not a blood sugar component that is causing you to urinate as well. Okay, I'm wondering if I should turn off the recording just to keep it under the hour. Yeah, I'm just going to turn off the recording. We're good there. Okay, stop recording.